Good afternoon. This is Babs Decatur. I'm the coding educator for general internal medicine, geriatrics, and primary care. I wanted to give you the updates for the 2017 ICD-10 diagnosis codes. We've been in a code hold for the last couple of years because they were waiting for us to implement ICD-10, which means the United States as a whole. The Centers for Medicare and Medicaid gave us a grace period of a year from the time we implemented ICD-10 to present to get familiar with the codes and how ICD-10 was laid out and that kind of stuff. Well, effective 10/1/2016, which is when the new ICD-10 codes go into effect, they're going to start looking and denying claims with unspecified diagnoses codes. Now, there are several instances where if you don't know a certain organism that causes a infection or something like that, and you're not going to test for it, then you code to the highest specificity that you know, which may be unspecified. But I highly suggest that you try to go to the most specific diagnosis code that supports your treatment. So what we've done is put together some terms that we think will help you find the most specific code available for a given problem. One of the big things this year was diabetes, and diabetic retinopathy was one of the ones where they've just added laterality to the most part. So before you used unspecified, mild, moderate, or severe with diabetic retinopathy, and with or without macular edema, and proliferative or non-proliferative. Well, they've expanded that now to add laterality, right, left, bilateral, and unspecified. And they also added with traction retinal detachment involving macula with or without regimatogenous retinal detachment with macular edema resolved following treatment. And this is probably not within your area of expertise to know these specific things. So I would highly recommend that you contact your ophthalmology specialist and make sure that they're updating the problem list if they are within our Emory system. If they're outside physicians, you're just going to have to depend on them to give it to you. And additional codes for diabetes include long-term use of oral hypoglycemic drugs and pre-diabetes. We were using a code last year that had in parentheses pre-diabetes, but they've expanded it to where pre-diabetes has its own code now. And the new codes for hypercholesterolemia are pure or unspecified, and then familial hypercholesterolemia. Okay, in the genitourinary system, some of the things that you might see are bacteriuria, other abnormal findings on microbiological examination of urine, elevated prostatic-specific antigens, rising PSA following treatment for malignant neoplasm of prostate, rising PSA following treatment for malignant, erectile dysfunction following radiation, interstitial seed or ablative therapy, and chronic bladder pain. Hypertension, they added acuity to the hypertension codes to report urgency, emergency, or crisis. And then they added 3 syndromes: a periodic fever syndrome, cryoprion-associated periodic syndrome, and other autoinflammatory syndromes. And one of the things I'd like to leave you with are documentation tips. You should always update the problem list to the most current specific diagnoses. Remove duplicates or conflicting diagnoses. I've seen examples where diabetes without complications was in the problem list, and also diabetes with peripheral neuropathy. Well, you know, it's got to be one or the other, and I would assume that if a patient's already progressed to peripheral neuropathy, that you would want to code to the highest specificity. And you need to document according to acuity and specificity. So if a diabetic patient also has retinopathy, nephropathy, you have to document each one of those in order to truly support the acuity of that patient. And please document cause and effect relationships, as well as linking complications to chronic conditions. If you have a patient that has hypertension and chronic kidney disease, you don't report the I-10, you report the I-12.9, which is hypertensive chronic kidney disease. And you also need to add the stage of the chronic kidney disease. Probable and suspected conditions should be reported as signs or symptoms until a definitive diagnosis is made. And that does it for us. If you have any questions, please send them to me or call me, and I'll get your answers for you. Have a good evening.